Hi there, welcome to the latest episode of my 10-minute moan. The topic of this 10-minute moan is £850 million that the Scottish Government has paid from the NHS out to private health companies in the last 18 months. So the story has been led by the Mail on Sunday, who have done a bit of investigating into this matter, and I'll talk you through their story and then give my opinion on it. The SNP's £850 million bill for private NHS work revealed huge scale of nationalist privatisation of health services laid bare as contracts worth millions handed to outside firms. Scotland's cash-strapped National Health Service has pledged to pay private companies £850 million to carry out NHS work in a desperate bid to ease pressure on its struggling staff, this newspaper can reveal. A Mail on Sunday investigation today lays bare the enormous scale of NHS privatisation under SNP government as the beleaguered health service increasingly attempts to outsource its core day-to-day functions. Since January 23, contracts worth hundreds of millions of pounds have been awarded to private firms, many of which are based in England, with some as far afield as Denmark and the Netherlands, to help with diagnostics, testing, X-ray assessments and treatments. It means that as the taxpayer-funded health service battles record waiting times and stretched resources, thousands of Scottish NHS patients and their records have been diverted to the public sector. Hospitals and GPs are increasingly relying on a charade of privately employed staff to bolster their dwindling ranks. Health Secretary Neil Gray and NHS Scotland last night confirmed the NHS records private healthcare spend only if it relates to a patient being sent to a private company to have their clinical procedure performed. They admitted their statistics do not include contracts for private agency staff, privately managed services for the collection and movement of products, and other private services, but day-to-day activities such as privately owned digital platforms, despite all of those duties being a core part of the NHS remit. This is going back to the SNP's claims that they've spent £81 million on outsourcing stuff. So they're obviously, with their figures, they miss out hundreds of contracts. Now, with the true extent of NHS Scotland's privatisation revealed today by the Mail on Sunday, First Minister Yousaf Swinney claims that he would keep the NHS in public hands and protect it from the threat of Westminster's privatisation, have been drawn into sharp focus. Last night, critics slammed the SNP for blatant hypocrisy and failing to get to grips with the crisis involving Scotland's NHS. Excuse me. Scottish Labour Health spokeswoman Jackie Bailey said, "This lays bare how staggeringly hypocritical it is for the SNP to criticise Labour for considering outsourcing and private contracts as a temporary measure to help with NHS capacity and drive down waiting lists. The SNP have the cheek to call themselves protectors of the NHS when it has been their failure to adequately strengthen the workforce and fund vital services over the last 17 years that has led to our NHS to be in a permanent crisis." Scottish Conservative Health spokesman Dr Sandesh Gillane said, "Scots will be shocked to learn that the SNP have spent a whopping £850 million on the privatisation of the NHS in the last 18 months alone, something which my party has always opposed." This paper trawled through all the public contracts awarded by the main NHS procurement team, National Services Scotland, since January 2023. Not including the buying in of vital medicines, the NHS in Scotland spent £850 million on outsourcing day-to-day activities. Some of the contracts are for services which will be provided over a number of years. A research shows that since the start of the year, £665,000 has been put aside to pay Cambridge medics to collect and test Scottish patients' oesophageal cells to help the NHS diagnose for certain cancers. A German firm, Fresenius Medical Care, has been awarded a £7 million contract to provide at-home dialysis for patients. A £30 million contract was awarded to firms to assess X-rays and other scans on behalf of Scotland's NHS, with one in Normandy, Denmark, given access to NHS patients' records. Another address listed in the procurement portal was for Mediscape, based in Zoetermeer, the Netherlands. One company in Harlow, Essex was awarded £1.9 million contract to dispense blood coagulants to homes across Scotland and deal with associated waste. Money is also set to be spent in the private sector on genetic testing of embryos before their implantation during IVF processes. A firm in Cambridge was handed £3.5 million contract to give Scots access to online therapy, with another company specialising in psychiatry allocated £13.6 million for similar work. Meanwhile, triaging for dermatological complaints will now be done online, with screenings carried out by Oxford clinicians for £561,000. A further £930,000 has been put aside for dermatology work, in part to reduce the number of face-to-face secondary care appointments, according to documents uploaded by the NHS. Video consulting services used to reduce face-to-face appointments are set to cost the health service £5.8 million. Money has also been spent on the provision of a range of inpatient procedures, clinics and outpatient services to support the NHS in Scotland, and delivering comprehensive and effective healthcare services likely to include procedures such as hip and knee surgery, cataract operations and vasectomies. But of particular concern to the industry bodies such as the British Medical Association is that the NHS has set aside an enormous £750 million to be spent on agency staff, with many companies supplying the workers being based south of the border too. This is the biggest thing for me. Obviously it's the biggest chunk, but that's French life for me, and I'll come back to that once I've finished the story. Other firms were awarded a further £33 million contract to provide workers. BMA Scotland Chair Dr Ian Kennedy said the money being spent on locums should instead be towards staffing the service properly. Can't really disagree with that logic. Permanent staff are not only by far the most cost-effective option, they also provide the stability and continuity of services that best serves patients. Alan Taman of a group called campaign group Doctors for the NHS lamented an increasing reliance by the NHS and private providers to carry out basic services. To concerned taxpayers and experts, however, the need to outsource key activities may be a symptom of the service under extreme and ever-growing pressure. The NHS in Scotland is battling waiting lists that are at a record high despite SNP pledges to eradicate long delays. Mr Gray said the use of independent sector to provide additional capacity is not a new development. As in cases across the UK in certain circumstances, limited use of alternative providers within or without the local area, including independent sector providers, may be required in response to capacity constraints. I understand that. The figure quoted related to a range of contracts, including the provision of agency staff, digital platforms and others. The SNP's Amy Callaghan said the SNP will always protect our NHS and keep our health service in public hands. I'm not sure how that squares with paying out £850 million from their budgets. Now, the biggest thing there is the staff. Now, I know through personal experience, through talking to theatre staff, I was at a funeral, unfortunately, when I had a discussion with a guy I've known for a few years but hadn't seen for a while. I hadn't seen him pre-COVID, and I was asking him, how COVID impacted in his life. And he told me he was a bit embarrassed that actually made him a wee bit rich, because he would finish his work as an NHS and then he would do agency work after it, and he was paid a ridiculous amount of money for that, more than his normal salary, and the agency were obviously making fortunes on top. Which beggars belief, when we've got staff within their own NHS who are leaving their work and coming back to work, possibly not even leaving that building, but being paid under totally different set of rules and totally separate monies and totally bizarre amount of monies. I will not go into the figure the man told me he earned during the 12 months in 2020 going into 2021, but it was mental. My jaw dropped. Life-changing amounts of money in 1 year. And he then went on to explain what he's doing now, and he's thinking of coming away from working for the NHS entirely, because his skills can be used by these agencies and charged back to the NHS and give him a far higher rate of pay, a far higher rate of yearly wage to do things that he would quite happily do within the NHS. So the whole system is bonkers, right? And it just fits in with my whole ethos that we don't run the current country properly. And I would love to get into Holyrood and have a look under the bonnet. And where I see a massive amounts of spend, bring in people that are better qualified to me and say, can you explain to me why we're spending all this money on this? And it might be quangos, it might be charities, it might be services that we're paying for, it might be supplies that we bring in. And I will guarantee you, someone with, you don't need to be Richard Branson level of business acumen to be able to save hundreds of millions, if not billions of pounds per year, and redivert that money into where it's really needed. Because we've got quangos and charities and specialists and the suppliers who will all be making fortunes off the Scottish Government, and this will be a great example of that. That we might not be able to save the £850 million if we didn't give them it, but we could spend it wiser. I guarantee you that, and save big, massive portions of it, which we could then put into things like NHS, roads, housing, addiction issues, education, all these things that the SNP have been telling us for 17 years that they don't have enough of. And I don't know how to do that, how to action that. But somebody somewhere must be able to get into Holyrood and just say, let's look at this little business. Now, we don't want to, I've said this a million times, we don't want to increase the income that you would do, you could look at as a business, because that would just be tax people more. But the other line in the accounts, the expenditure, to actually spend some quality time looking into this, I guarantee you, even somebody with my experience would be able to go in and save hundreds of millions of pounds, if not billions per year, and redirect that to better places. And it's something that's been in my head for a while now, and I've spoke about it in numerous videos, that the wastage from Holyrood is astronomical, and even the place itself costs too much money. But that's a debate. It's a different debate whether it should actually be there or not. However, if we've got it, can we utilise it properly? And if we make pennies the prisoners, the pounds will look after themselves. And I've worked in business commercially, selling to the public sector, supplying the public sector, and it's frightening. There's two different price lists by every commercial company I know of when they're dealing with public or private sector. The public sector is a lot more because they can get away with it. So, I don't know, it's a wee thing that's in my head as a thought, and I want to develop it as to how we can do this for Scotland. And it's not just the NHS spending 850 million quid, that'll be the tip of the iceberg. There will be loads of more places. We've got all these quangos set up. Do we need them? Do we get good value from them? And if we don't, do away with them. And whatever you save for that, we'll have suppliers that are selling us watermelons for 10 quid and stuff, things like that. I guarantee you there will be hundreds, if not thousands, of examples of that. And if we can save all this money, we could have a better Scotland. But unfortunately, what's happened is, for the last 17 years, we've had a government in place that are not really that interested in running Scotland. They're interested in getting independence and, filling their own coffers and giving people one sole reason to actually vote for these crackpots in the first place. And I want them out. And I want normal people to get in and deal with it as like a business and make Scotland better without charging Scots more for it. I don't see it being that difficult, if I'm perfectly honest. So if you enjoyed the video, give it a thumbs up. If you've not already done so, please consider subscribing. Get involved in the comments below, they're always good fun. But more importantly than all that, unless you're the SNP or anybody in the health service that thinks this sort of stuff's good, everybody else have a great day. Cheery bye now.